Hi, I'm Dr. Brian Koffman, a retired family doctor, a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm going to be sharing with you some of the most important research that came out of the American Society of Hematology's annual meeting and exposition that was held in December of 2021 in Atlanta, Georgia, and also held virtually. This is often shortened to ASH 2021. The first paper I'm going to present is on real-world treatment patterns and outcomes of patients with chronic lymphocytic leukemia, or CLL, receiving first-line therapy in the United States. And as we all know, there have been many advances in the management of chronic lymphocytic leukemia, small lymphocytic lymphoma, treatments over the past decade, with several potent novel agents targeting molecular pathways within CLL cells, receiving FDA approval and becoming part of our armamentarium to manage the disease. At ASH 2021, Dr. Anthony Mato and the other researchers reported the results from a large multi-center retrospective study on the evolution of molecular testing patterns, what were the treatment patterns, and what were the clinical outcomes over time in patients receiving first-line CLL treatment in this real-world USA database. So here's the takeaways from this. There was a large number, 3,654 patients who were treatment naive who had CLL that were studied. Time at the initiation of frontline therapy, age at the initiation of frontline therapy was 70. 64% of the patients were male, 72% were white, 8% were black, 3.9% Hispanic Latino, 1% Asian, and 14.9% were of other ethnicities and races. Let's take a look at the testing patterns. Compared to the data collected in 2015-16, testing rates were higher in 2019 through 2020, as we would hope, for 17p deletion, 36% versus 45% at the later date, and IGHV mutation, 84% at the earlier date, 89% at the later date. Let's look at the treatment patterns now. 45.7% received regimens that involved the novel targeted oral agents that we talked about that have so revolutionized the care in CLL. But still over a third, at 33.4%, received chemoimmunotherapy. Almost 20% received an anti-CD20 antibody as monotherapy, as single therapy. That would be rituximab or obinutuzumab. Novel agents usage increased from 27.1 at the beginning of the study, 2015 through to 2016, to a much more comforting 63.8 in 2019 to 2020, with use of chemoimmunotherapy and chemotherapy itself decreasing over time. What were the outcomes? Time to next treatment or death was 47 months for those who received the novel targeted oral agents versus 41% for patients who received chemoimmunotherapy. 6 months longer, people were living or needing another, or living to where they needed another treatment. So in conclusion, as we would hope, the use of testing and of novel targeted agents has increased over time, with a corresponding improvement in time to next treatment and delaying, keeping people alive longer. After many years, more and more patients are getting the benefits of the proven clinical superiority of targeted novel agents, but we still need to work to ensure that all patients are getting their best possible care. More than half of the patients are still not being tested for deletion 17p, when all guidelines insist it should be checked before starting therapy. And 1 out of 3 patients is still getting chemoimmunotherapy when it's proven over and over again to be an inferior choice for nearly all patients. We have our work to do, but this research is helping point us in the right direction.